Hello everyone. So in this video we would be covering active management of third stage of labor. So I'm not sure if I could stick to time limit of 20 minutes because this is somewhat big, huge. So I'll see how long it takes, and I'll upload the entire video. So I'm going to be breaking the rule. Yeah. So coming to the definition, active management of third stage of labor. Now, in short, it is AMTSL. Don't get confused during exams. Not so complicated. Active management of third stage of labor is an evidence-based clinical practice aimed at minimizing blood loss and preventing PPH. So before going over here, we need to know what the stages of labor are. So here you already know. Stage 1 is the initial phase where the dilatation of cervix occurs. So this one is that, and you can see in the image. And in stage 2 the baby comes out, and in stage 3 the delivery of placenta happens. So delivery of placenta, like along with the umbilical cord, like during this process there could be a lot of hemorrhage, and that itself is postpartum hemorrhage. So in order to reduce that, we actively manage the third stage of labor. So that's what it means here. So it involves the administration of uterotonic drugs and specific maneuvers to ensure early placental separation and effective uterine contraction. So administration of uterotonic drugs. So uterotonic meaning increase the tonicity of the uterus, meaning not relaxing, meaning contracting, so increasing the contractile state, and specific maneuvers to ensure early placental separation. So you want the placenta to be separated early so that you don't lose a lot of blood, and this is the same thing, like increasing uterine contractility. Coming to principles, so first one is stimulate effective uterine contractions. So that is number one, primary, and we'll go through each and every point first, then in detail. Reduce postpartum hemorrhage, shorten the duration of third stage, minimize maternal anemia. So primary goal is to induce strong uterine contractions immediately after delivery of the baby to promote placental separation. So you want the uterine contractions to occur, like that is required even for this one. What is it? For the placenta to get separated. Yeah, so I missed that there. So uterotonic drugs, these two things ensure these two things. So these two plus this equals this plus this. So that is the overall understanding. Uterotonic drugs plus specific maneuvers equals placental separation plus effective uterine contraction. And reduce the postpartum hemorrhage by ensuring expulsion of placenta and sustained uterine contraction. The risk of PPH is significantly reduced. So next one, active management shortens the third stage of labor to reduce the maternal exhaustion and risk of complications. So maternal exhaustion also reduces, and the risk of complications also reduce. Minimizing maternal anemia. So if you reduce the blood loss, automatically even the complication of blood loss, which is anemia, is reduced. Reasoning, these principles focus on preventing excessive bleeding, which is the most common cause of maternal mortality after childbirth. So these are the principles. So uterine contractions, postpartum hemorrhage, reducing the duration, minimizing the instances of anemia. Coming to components of active management, AMTSL consists of all of these. So it mentions, so sorry about this is supposed to be just 3. I'll just remove it later after this video. So it is 1, 2 and 3. So these 3 things. This came out extra, formatting error. Yeah, so oxytocin 10. So these are the drugs. Oxytocin 10 international units, IM or IV, is the preferred drug to be administered within 1 minute of delivery of baby. So immediately 1 minute after the delivery. Alternatively, methyl ergometrin 0.2 milligram IM can be given if oxytocin is not available, though it is contraindicated in hypertensive patients. So oxytocin just acts on the uterus, but this one potentially even the rest of the blood vessels in the body. So uterotonic drugs cause the uterus to contract, which helps in the separating of placenta and reducing the bleeding. Okay, so we have understood the first part. Next one is it looks too disturbing having this, so yeah, I'll take it off. Yeah, next one, yeah, control contraction, also known as Brandt-Andrews method. This involves actively applying gentle traction to the umbilical cord while supporting uterus to facilitate placental expulsion. The uterus should be firm and contracted before applying traction to prevent uterine inversion. You don't want uterine inversion to occur, so that's why you are doing this. So let's see Brandt-Andrews method. So you can see over here, let's see, yeah, so here to determine, so firm traction is applied on the umbilical cord with the one hand, so this is the one, this one, while the other hand applies suprapubic counter pressure. So this is the Brandt-Andrews method maneuver. So overall the uterus should be firm and contracted before applying traction to prevent inversion. So this is the prerequisite, otherwise it can lead to uterine inversion. So let's see uterine inversion, how it looks like. I'll put this here. Hopefully in this video there are no lags, like even if I search on Google and all that, because I noticed in the settings the video resolution was very high and the output was almost at 4K level. So because of that there was so much of lag. Now I have reduced it to 1080p and everything should be fine. And now hopefully I can keep the video on. Even the last video it was a mess, the last part after 15 minutes. Yeah, so you can see over here the uterine inversion. You can see it comes down and finally this is the 4th degree, it's completely out. Yeah, reasoning, control contraction aids in early delivery of placenta, but it must be done carefully to avoid the complications of uterine inversion. Uterine massage after placental delivery. After placenta is delivered, the uterine massage is massaged through the abdomen to encourage firm contraction and minimize bleeding. So it is continuous and minimize bleeding. After placenta is delivered, the uterus is massaged through the abdomen to encourage firm contraction and minimize bleeding. Regular assessment ensures the uterus remains firm. So uterine massage is the third component. So reasoning, a firm uterus compresses the blood vessels, reducing the risk of bleeding. So this is what it is. These are the three main components. This can come as a 3 marker too. It has been asked so many times even in our college exams, this particular thing, the components of AMTSL. So they make it like this, AMTSL. So it becomes like, what is this? Then okay, third, active management of third stage of labor. Yeah, that is what it is. Third stage of labor, wherein the placenta is delivered, and during the placenta delivery even lot of blood loss can occur. So that is what we are trying to manage to avoid in the first place. And so for that we have a maneuver known as Brandt-Andrews maneuver method. And then there is also uterine massage. And first of all, before all of this, there is administration of uterotonic drugs. Which are they? Oxytocin and methylergometrin. One is 10 international units IM or IV. Next one is 0.2 milligram IM for methylergometrin. And oxytocin is preferred. Advantages: reduction of blood loss. AMTSL reduces blood loss by up to 60% compared to expectant management, decreasing the risk of postpartum hemorrhage. So this is I think the normal without any kind of this thing. Expectant management versus AMTSL, meaning mostly this is the normal thing, physiological, yeah, exactly, the normal thing where you leave it without any kind of intervention. But in this particular case, MTSL, it is you are actively managing it. Shortens the third stage. The duration of third stage reduces from 15 to 20 minutes to about 5 minutes. You can see the difference, 15 to 20 to 5 minutes. So if it was 20 minutes, 5 minutes equals reduction, like it's at 25 by 75%, like reduction by 75%. So which is really nice. Yeah, right, 75. Yeah, I think so. Yeah, minimizing the risk of complications. So since you have lesser of time duration, the surface area to commit mistakes, the surface time level in this case, so the time duration wherein everything can break loose, it doesn't happen here because time duration itself is reduced. Prevent maternal anemia by reducing blood loss. AMTSL helps prevent postpartum anemia, contributing to better maternal health. So this one you have already seen. Minimize the risk of retained placenta. Controlled management reduces the incidence of retained placenta, a common cause of postpartum hemorrhage. So retained placenta, common cause of postpartum hemorrhage. Reasoning: these benefits are crucial in settings with limited access to emergency obstetric care where PPH can be life threatening. Yeah, so we have seen the advantages. So it's the same thing what the goals were, we are principles, same thing is advantage. So what's the disadvantage of all of this? Risk of retained placenta, slightly increased risk of retained placenta and may require manual removal. So okay, since here it's not physiological, maybe that is the case. Yeah, uterine inversion we have also. Let's check this little bit in detail why that is the case. Why in AMTSL? Due to, yeah, we already know this, CCT and early uterotonic administration. Premature uterine contraction before complete placental separation. Oxytocin given immediately after delivery of baby, causing uterus to strongly contract. If the placenta is not fully detached, strong contraction may cause cervix to start closing while the placenta is still attached. Okay, so cervix closure is what we are looking at. This traps the placenta inside. CCT. So there is CCT, Brandt Andrews technique. If CCT is done too early before the complete separation, placenta may not detach properly, leading to partial retention. So everything should be timed. This leads to placental adherence to the uterine wall, increasing the risk of placenta accreta. Now we are new term. Cervical closure before placental expulsion. So that is the first point. Uterotonic effect can cause rapid uterine cervical contraction before the placenta is delivered. If the cervix contracts tightly before the placenta is expelled, it may become trapped in the uterus. So it's the same thing over and over again. So it is like timing is not right. So let's before jumping on back into our old discussion, we need to anyways we have accepted that we are taking a really long time to finish this. So let's learn little bit extra. Not adherence, which was the other one? Placenta accreta. Yeah, this was the one. Placenta accreta, percreta and all that. Should we learn that now itself? Because I feel it's better because it is not given here specifically. So is it given here? Yeah, it is here itself. So let's finish this off, then go back to AMTSL, because this is the way I feel is the best learning method, like not specifying oneself to one topic, just leave it loose and see where it goes. Placenta accreta is a condition where placenta abnormally adheres to the uterine wall without detaching after delivery. Yeah, same thing, you understand, because I understood. Increasing the risk of severe postpartum hemorrhage. It is the most common cause of PASS syndrome. Yeah, so detached. So first one, there are types. Too deeply into the decidua basalis. So that is one of the layer of uterus, so inner lining, but does not invade the muscle. So in this particular, no muscle invasion. Increta invades the muscle, but does not go through the entire wall. Percreta, more severe form, penetrates through the uterine wall, possibly attaching to the nearby organs like bladder or bowel. So it passes through everything. So there are these risk factors and all that. Should we go into the details? No, we'll just look at the highlighted points. Defective decidualization, meaning the normal separation layer between the placenta and uterus. So placenta is one thing, uterus is something else. This is a tissue that is developed. So it fails to, you don't have a proper separation. So because of that, there is more of invasion. Previous surgery. So what can cause previous surgery, like scar and all that? disturbs the normal homeostasis over there, and proper separation is missing. Placenta previa, placenta covering the cervix. Multiparity, repeated pregnancies where the lining is not normal. Not normal meaning it is messed up. Is that the right way to say it? No, it is like not ideal for the placenta to be attached. Yes. Maternal age greater than 35. Okay, this is like risk factor of so many things. IVF. Okay. Clinical features: asymptomatic painless vaginal bleeding, difficulty delivering placenta after birth, severe PPH. Okay, we can do USG, MRI. Yeah, extra things no need. Yeah, coming back, uterine inversion. Should we go into? No, we are not, because I feel I heard somebody discussing about this the other day, so I thought I need to read about it. So I just read. Yeah, coming to uterine inversion, we have already seen the degrees of uterine inversion: 1, 2, 3, 4. I doubt we need to go more in depth, or is there a, let's see, hypertensive crisis. So methyl ergometrin can cause hypertensive crisis if used in women with preeclampsia or chronic hypertension. So it can cause this thing. Probably it is because of this one. What is that? Systemic effect of why causes STN crisis, hen crisis. It's lack of chicken, you lose protein. Methyl ergometrin is okay. Why is that? Potent was a vasoconstrictor effect. Yeah, so causes intense vasoconstriction, increasing PVR and all. Yeah, systemic effects. No need to go in more details. So yeah, so here's the thing: skilled personnel to required complications. Fourth point we missed: increased need of manual intervention. In some cases, AMTSL might increase the need of manual removal. A spontaneous expulsion does not occur. A spontaneous expulsion doesn't occur. You need manual removal. Coming to procedure of active management. So immediately after delivery of the baby, administer 10 international. So we have already seen this, the drugs, the dose within 1 minute of the delivery. So within 1 minute, this or this, but this one is better. Clamp and cut the cord. The umbilical cord is clamped following the clamped and cut following the delivery. Next, coming to control contraction, Brandt Andrews. So one hand on the lower abdomen. So we have seen this image. Let's check it out again. So one hand on the lower abdomen and another hand gently pulls the umbilical cord while applying upward pressure on the uterus to guide the placenta out. While applying upward pressure on the uterus to guide the placenta out. Ensure that the uterus remains hard and contracted during this process. So that is key. Otherwise, it might not separate properly. And next, coming to delivery of placenta, as it emerges out, twist it gently to ensure complete delivery of the membranes. Twist it gently to ensure complete delivery of the membranes. Inspect the placenta and membranes for completeness. So check this thing for completeness, the placental membranes. Uterine massage. Following the delivery of placenta, the uterus is massaged through the abdomen to encourage contraction. So proper massage is also important to encourage contraction. Periodically reassess the uterine tone during the first hour postpartum. So periodically reassess uterine tone during the first hour postpartum. So that is after the massage. Monitor for postpartum hemorrhage. Closely monitor the patient for at least 1 hour to detect signs of excessive bleeding or uterine atony. So atony leads to meaning not enough tone. So what happens to the blood vessels? They are free to dilate. Then what happens if there is lot of dilation? Like they are not. You need this. You don't want this. If it is this, blood loss. Yeah, coming to indications of AMTSL. So where there is high risk of PPH. So in the case with high risk of PPH, including anemia, grand multiparity, history of postpartum hemorrhage, multiple pregnancies, prolonged labor, polyhydramnios. So anemia, grand multiparity, history of postpartum hemorrhage, multiple pregnancies, prolonged labor, polyhydramnios. Finally, coming to contraindications. So cardiac diseases, severe preeclampsia or hypertension, or suspected uterine rupture. So cardiac diseases, methyl ergometrin is contraindicated due to risk of cardiac overload. Severe preeclampsia or hypertension, because methyl ergometrin can cause hypertensive crisis. Suspected uterine rupture, uterotonics can worsen bleeding if uterus is ruptured. So you don't want extreme contraction, which can lead to this. So the existing factors are which can cause this. So probably that section is there somewhere, uterine rupture or something. Anyways, yeah, it should be there. It should be there somewhere. Yeah. Coming back. Flowchart. Administer the uterotonic drug, clamp the cord, CCT, deliver the placenta, uterine massage, and monitor bleeding. Yeah. So with this, we come to the end of AMTSL. Personally, the first time I went looked at this word, this thing AMTSL, I was very surprised and no, not surprised. I was really confused. Yeah. So right now, I'm not confused. So because this thing is really extremely clear for me. So hope that's the same case for you too. So in case you have any questions, yeah, it's 20 minutes, really good. So we have discussed another topic too, which was placenta accreta, and we saw the different types and why that thing occurs. Overall, I think it's a good use of our time. Anyways, we'll end the video right now, and in case you have any doubts, you can write it in the comments. I doubt you will have any doubts because the teaching was so good. And one more announcement. I doubt anyone would watch this particular section, but anyways, I need to mention this. In case you find any kind of mistakes in the particular on the website, the whatever content is given. For example, just now I found a mistake, right? This is not a mistake, formatting error, formatting error. So these are the three things. So there are multiple. So in this particular case, in case you find such errors, in case you report those to me, like either by sending the screenshot or just mentioning exactly what it is. If you screenshot, it is better for me to go through. So then, and after that, if I go about correcting it, if this thing is legit, and if I correct it, I'll make sure to include your name over here in the, where is it? I'll reload it. Yeah, in the credit section. So currently we have Killing Spree, the great senior from whom the project was inspired. Next coming to Mukul Shetty, who is a friend of mine, and you can be here too. This is one of the initial steps. So what you do is you just find any errors in the website and just report them to me. So you know where to reach, just any particular random thing, and click over here. You have any suggestions, send them here. So click this button, you will reach the Instagram of this particular website. Just send the mistakes, and then I'll make sure to correct it and include your name into this section. You will have your name, and with that I'll also mention what are the mistakes you helped me correct. So I think it would be really helpful even for you as your efforts have been what is that? How do you say it? Has your efforts have been people have seen your efforts. I don't know how to bring it out. So your efforts have been taken note of. Something like that. So just message, and we'll make sure this website becomes really good. Okay then, bye bye.